A little spit may help predict whether a child's concussion symptoms will subside in days or persist for weeks. A test that measures fragments of genetic material in saliva was nearly 90% accurate in identifying children and adolescents whose symptoms persisted for at least a month, according to a study published Monday in JAMA Pediatrics. That's in contrast to a concussion survey commonly used by doctors that was right less than 70% of the time. If the experimental test pans out, a pediatrician could collect saliva with a swab, send it off to the lab, and then be able to call the family the next day, Stephen Hicks, an assistant professor of pediatrics at Penn State Hershey, told NPR in May, after presenting preliminary results at the Pediatric Academic Societies meeting in San Francisco. Hicks is the lead author of the study and consults for a company that hopes to market concussion tests. A reliable test would help overcome a major obstacle in assessing and treating concussions, which affect more than 1 million children and adolescents in the U.S. each year. Many of the injuries are related to sports. In most cases, concussion symptoms last only a few days. But up to 25% of young patients go on to have these prolonged headaches, fatigue, nausea, and those symptoms can last sometimes 1 to 4 months, Hicks says. And right now there's no way to know which kids are going to have long-term problems, he says.